bless.
Let's keep it going here. We're going to knock out our hospital update here with Lillian Posadas, hospital administrator, and then Jason's going to take it over to IT&E for Black Friday. Good morning, Lillian. Thanks for joining us. Happy Thanksgiving.
Good morning. Happy Thanksgiving, belated Thanksgiving to everybody. Good morning, Guam.
Good morning.
How's everybody?
We're here. We're alive. We're thankful for it.
Yep.
That's right. We are thankful. We are grateful.
So what's the situation there with the Guam Memorial Hospital, Lillian?
Our census is at 43 today. And of the 43, 8 of them are at the ICU level of care. And of the 8, 2 of them are on ventilator support. And so, hopefully that the numbers continue to, go in a downward trend. But, with yesterday's Thanksgiving holiday, hopefully that people really adhere to just, sacrificing and, so that next year we'll have a big bang Thanksgiving celebration. We'll get through this.
What about the number at the SIF?
The SIF has come down to 4. So we're looking at possibly if any of those 4 can go home, or we bring them back here and then we can stand down the SIF so we can get the HVAC system worked on and separate the system so that therefore there's the COVID and non-COVID patients that we can put in there.
Mm-hmm.
That will give us that opportunity to work on the HVAC system.
Okay. How many vials of Bamlam been used so far out of the 25?
Bamlanimab. Yeah. Well, you know what? I asked our our pharmacy for an update, and I haven't gotten. But last time that we talked, 4 individuals received the Bamlanimab therapeutics, and I believe 2 individuals were given the convalescent plasma treatment. So there may have been more, yesterday, and but I'm getting the update. I haven't gotten a response from our pharmacy and from our infection control team. So I'm waiting for them to respond.
Can you tell me a little bit more about the convalescent plasma? This is also from HHS, and is this also through transfusion?
Yeah, it's through transfusion. It's just like receiving fresh frozen plasma, blood transfusion. And so, but the convalescent plasma is just really the liquid, they remove the red blood cells from that blood product. So it's just the plasma that's filled with antibodies, with protein, with electrolytes, and other nutrients, but primarily the antibodies from individuals who have had COVID. So, the theory is that, and the scientific data on it is that those antibodies from individuals who recovered from COVID is what then these individuals will receive from this convalescent plasma. It's to boost their immune, to give them the additional antibodies so that they can, get through this COVID infection, with the better results and better recovery. That's what that convalescent plasma. What we received was from the American Red Cross. We received 20 units. And so that's what we're using, the 20 units of plasma that we received from Red Cross.
How many have been used out of the 20?
Well, like I said, 2 so far is what I received, but I'm waiting for an update.
Okay.
Yes.
Has there been any other deaths since the JIC came out yesterday?
Yesterday, yeah. Yesterday, there were 2 yesterday. Mm-hmm. And so none throughout the night. And I haven't heard any as of this morning at 9 o'clock.
Okay.
I haven't received any reports. So knock on wood, hopefully no one else.
Any more staff infections?
What was that, Chris?
Any more staff infected with the virus since the last time we spoke?
Total as of Wednesday, we had 91 employees who tested positive, but that's since the beginning of this, second wave in August. Mm-hmm. Majority of them have been cleared, have gone back to work. And so they've, I think the last time it was only like about 2 or 3 who were out in isolation status.
Do you have any numbers for how many DOC inmates are at GMH? The last was 5, and are there any officers?
We have 4 right now in the house.
Inmates?
Some of them have come to, 4 who are admitted. Some of them has come to the emergency room, but their conditions, according to the doctors, do not require for them to be hospitalized. So they were released back. But as of this morning, we do have 4.
4 inmates.
Yes, ma'am.
Okay.
4 inmates.
Any new staff arrived over at GMH? Any help?
We're getting some this weekend. Additional nurses are going to be arriving this weekend for the ICU and for the telemetry area.
How many?
I believe either 5 or 6 RNs are coming in. They've had to replace some of the ones who had to leave because of family emergencies. They've had to go back home to their location because of family emergencies.
Thank you, Lillian, so much for your time this morning. And I don't really see you as the go shopping Black Friday type, but if you do, don't forget to think about us here on the link. We thought of you this
I don't
morning.
do Black Friday. I don't do Black Friday. The lines are too long.
We thought of you, though. There's virtual Thanksgiving leftovers in the Zoom room if you want to take some.
Okay, good. Thank you. Yeah, I had my stuffing too yesterday. So
Yeah, Jason had his stuffing too.
Everybody got a lot of leftovers. But you know what? Hey, let's enjoy it while we
There you go.
can.
Thank you, Lillian.
Thank you too. You take
God
care.
bless Guam.
All
God
right.
bless GMH. There you go.